blood pressure or high blood pressure is considered as the silent killer. It's a killer, but it's a silent killer, which is more dangerous. This will be the outline of the talk, which I'll skip most of the portion as I have been instructed forcefully. Then how to categorize high blood pressure or normal blood pressure? Then normal blood pressure, everybody knows, pre-hypertension is below 140 and diastolic below 90. Stage 1, 140 to 160, stage 2, 160 to 180. And above 180 is very dangerous, and it is called as malignant hypertension or hypertension crisis. Hypertension is related to heart and other organs, which we are going to discuss. Prevalence is going higher and higher. In India, around 30% of the population is suffered from the hypertension, which is related to the growing age also. Cutoff line is since beginning is around 50 years, where the stiffness of the arteries take place. Urban and rural comparison, there is not much difference except in the awareness and early detection. Hypertension is a dangerous thing, which is responsible for the 57% of the all stroke death and 24% of the coronary heart disease. So it is much more related to the death via brain than the heart. Dr. Johri is sitting here, and we just visited a hypertensive conference related to brain and heart. Now, it's more dangerous after the 50 years, and risk of the hypertension and its complication increases when patient grow above 60 or 65 years. So more the age, more complications may arise. Prevalence, awareness, treatment and control of the hypertension, we all know. We have to take medicines and we have to take several precautions which we are just discussing and building this strong foundation for securing the future of hypertensives. We require a good treatment for hypertension, but before that we have to measure. How to measure blood pressure? By screening, by this was a history when how it was diagnosed. Initially it was diagnosed as an invasive procedure. Initially both the procedure which were used to diagnose blood pressure were invasive, and it was quite uncomfortable to the patients. Later, in 1890, one Italian physician, Mr. Riva Rossi, has invented the sphygmomanometer which we are using nowadays. These are the guidelines in India how to measure the blood pressure, but unfortunately if we are going to follow it, we have to take half an hour to 45 minutes for measuring the blood pressure of a single patient. So I don't think anybody can follow or anybody is following. The other thing is ambulatory blood pressure monitoring, which is required for some patients, which are those who are having fluctuating blood pressure, those who are having nocturnal rise in the hypertension at night time, non-dippers they are called. We use ambulatory blood pressure monitoring for borderline hypertension, white coat hypertension, like patients, those who are coming to the doctor's chamber and they are having white coat hypertension is due to fear or stress. Why it's safe to control blood pressure? Because blood pressure is affecting so many organs, so we have to protect these end organ damage. These are the complications of the blood pressure. Heart causes so many changes in the blood pressure causes so many changes in the heart vessels to act like a silent killer. There are no symptoms usually, but sometimes overstressed people, hypertension, anxiety, fear, tension, headache, palpitation, nasal bleeding, brain damage, hemorrhage, heart problems are usually taken as the first symptom of the hypertension. How we are doing silencing the silent killer? We are treating blood pressure. There are so many guidelines with blood pressure, antihypertensive agents, diuretics, beta blockers, calcium channel blockers, RAS blockers. RAS blockers means renin-angiotensin system. Guideline of hypertensions like consensus and controversies. So comparison of the JNC 7, 8, European guideline, American guideline. Usually what we feel in American guidelines and European guidelines, they prefer diuretics. And in India, we must prefer either calcium channel blocker or RAS blockade for the treatment of hypertension as the first line drug. Then combination of the drugs. Indian hypertension guideline use the combination of the drug like polypills. Polypills are combination therapies which gives better compliance for the patients, and two drugs, if they are used in the lower dose, is considered as better than a single drug in higher dose. Then hypertension, younger versus older, beta blocker should be used or not? Yes, we are using in India beta blocker in young hypertensives because they are having anxiety associated, stress associated, tachycardia, palpitation. So all these medicines are not available for everyone. We have to see other factors also, cardiac condition, renal condition, double drug, triple drug, monotherapy. All this will be the physician is the best judge to decide which drug to be used for which patient according to the guideline. Then single pill and the combination treatment both can be given to a patient with mild, moderate and severe condition. These are the JNC 7 and 8 comparison. I don't think we should go in such detail, but in JNC 7 they recommended diuretic first to use, and JNC 8 said you can use the other drugs like ARB with the diuretics. Combination therapy should be used in majority of the cases, and JNC 8, European, elderly and American Society of Hypertension all are having consensus over the issue of the combination treatment. These are the conclusions. The 140/90 is the cutoff line. We should treat the patient above 140/90. Below 140/90, we should do advise lifestyle modification and other things. For we have to remove the bad habits, then give milder medicines initially, and hypertension remains a condition of public health importance in India. Methodology we have already discussed, and ambulatory BP monitoring we already discussed. Then recent trials, I have omitted that part. Until more data emerges, evening dose of antihypertensive can be advised. Evening dose prevents morning episodes it has been observed in so many studies. Then your heart should have healthy food, tobacco, smoking should be avoided, regular physical exercises. The most important thing is people are doing, as it is not giving any symptom. Hypertension is a silent killer. So don't take hypertension for granted कि हमारा बीपी तो इतना रहता ही है. No, it causes end organ damage, and hypertension can kill a person suddenly. So thank you for your patient listening, and thank you, Kadila, for giving me the chance. I hope I have fulfilled.